Hello everyone, and welcome to Dr. Mercola's Cellular Wisdom, the show where we peel back the curtain on health topics you never knew you needed to know but can't help wanting to. I'm Ethan Foster, your friendly neighborhood observer of the human condition. I'm the guy who calmly reads every label, even on a bottle of water, just in case it has surprising side effects.
And I'm Alara Sky, a big fan of science, nature, and occasionally turning everything we think we know on its head. Some people call me a walking medical library, with a sense of humor attached. I prefer to think of myself as a comedic side effect with zero drowsiness guaranteed.
Today we're diving into something that affects an awful lot of folks, benzodiazepines, or benzos for short. They've often been branded as the ultimate solution for anxiety, insomnia, and a bunch of other things. But, as with every silver lining, there's a cloud, and that cloud in this case may be pretty stormy.
I like how you're tiptoeing around it, Ethan. Just say it. We've got a tiny, friendly pill that can lull you into a false sense of security, lead to physical dependence, and create brand new problems you never signed up for.
Precisely. But before we start, let's set the scene. People first leaned on barbiturates over a century ago. Then we found out that made-for-TV disclaimers like may cause cognitive impairment, respiratory depression, coma, or possibly leaving your keys in the fridge again were more than hypothetical. These barbiturates were powerful, but they arrived in your system with a marching band of complications.
Indeed. So, along comes a safer alternative. At least that's what everyone hoped. Enter benzodiazepines. They quickly became the new and improved answer for anxiety, insomnia, seizures, mania, and apparently that fear we all have of forgetting to clean out our spam folder.
Marketing played a big role. One company ran a massive clinical trial. They tested more than 20,000 people, but only about 1,163 were eventually presented to the FDA. They managed to paint a gloriously rosy picture of a drug that magically erased anxiety without causing any problems.
So basically it's like picking only the well-behaved kids in your entire school and saying, look, no troublemakers here. Obviously this entire school is perfect. Or, in the medical sense, the drug looked safer than it really was because they left out thousands who had some not-so-sparkly outcomes.
Then came the mania for prescribing. And I'm not talking about the kind that needs lithium. It was the marketing kind. Pharmaceutical ads galore, with an emphasis on diagnosing anxiety in nearly everyone who had a single worry. Before long, you'd find these prescriptions floating around in millions of pockets. You had doctors pushing them left and right, especially general practitioners who had about 15 minutes to solve your entire life story. If your problem was insomnia, well, here's a pill. Feeling stressed? Another pill. Not feeling stressed, but want to make sure you never do? Sure, let's get you started.
It's weird how quickly that pendulum swung. One moment, barbiturates were the talk of the town. Then they were demonized for their dangers, and benzodiazepines waltzed in as the hero. Except, guess what? They also have a disco ball of side effects. For instance, sedation, lightheadedness, and poor coordination. A perfect trifecta if you want to trip over your own shadow or wonder where the day went.
You left out my personal favorite, memory impairment. A lot of folks describe moments where time seems to vanish, hours go missing, or they can't remember entire chunks of a conversation. It's the ultimate, what was I talking about again, experience.
And you also have that irritating phenomenon called anterograde amnesia, meaning you struggle to form new memories. So if someone's telling you a funny story while you're on a strong benzodiazepine, don't expect to recall the punchline. You'll be stuck in comedic limbo.
There's also the not-so-minor problem of physical dependence. These drugs can cause your brain to adjust in ways that make it very difficult to quit. It's kind of like if you start depending on your phone's GPS to get everywhere. Eventually, you can't drive to your local grocery store without hearing that robotic voice telling you to turn left. Benzodiazepines can be that internal GPS. Once you rely on them, your own system forgets how to navigate.
And if you take them for weeks, or sometimes even just a few, the discomfort of trying to quit can be monstrous. Anxiety comes back stronger than before, insomnia ramps up, and you've got a host of other withdrawals. Irritability, tremors, hallucinations, delusions, paranoia, muscle pain. Basically, your body throws the biggest tantrum possible.
Let's not forget the possibility of seizures during withdrawals if you stop too fast. It's a major reason why you often need a slow, methodical taper over months or even years. You can't just decide one day, well, I'm done with this, and drop them in the trash. Even a small step down might cause your body to freak out.
I personally find it ironic that a drug meant to treat anxiety can wind up making everything more stressful if you don't do it the right way, or if it's used incorrectly in the first place. Now, don't get us wrong. They can be lifesavers for certain situations. For instance, in a specific type of anxiety, or for short-term use while other therapies get rolling, or occasionally for things like epilepsy. The problem is that it's rarely just short-term. People are left on these meds for years, sometimes decades.
You see that a lot with seniors. They might have trouble sleeping or some anxious moments, and a doctor prescribes a benzodiazepine. Over time, they need higher doses, or they end up with major coordination problems, confusion, increased risk of falls, and one fall can create a cascade of health issues. Despite recommendations not to give these to the elderly, prescribing rates actually go up with age. So, we have older folks taking a medication that's especially dangerous for them.
And pregnant women? That can be risky too because benzodiazepines can harm a fetus. Yet there are still plenty of pregnant women who end up on them. Then you have the younger population. Xanax, for instance, has been notoriously popular. People say it gives a temporary euphoria. Many mistake that rush for actual healing. Then you get into that cycle of wanting more and more. Meanwhile, the root cause of anxiety never really gets addressed. It's like painting over mold without ever cleaning out the spores.
Exactly. The mold's still there, lurking. And ironically, the longer you take the drug, the deeper that mold can spread. That's why some folks end up with that phenomenon you mentioned, the rebound effect. You stop taking the benzodiazepine, and the anxiety or insomnia comes back with a vengeance, as if it's on steroids. So you run straight back to the comfort of the pill.
There's also a huge marketing angle with drugs like Xanax. The developers basically declared a nationwide panic disorder epidemic, pitched Xanax as the knight in shining armor, and boom, blockbuster drug. No wonder it's one of the most commonly prescribed psychiatric meds around.
Another concern is mixing benzodiazepines with other depressants, especially opioids. That's a lethal cocktail for respiratory depression. Overdose deaths have shot up. It's not a small number. And it's not some distant headline. These are real people whose lives have been cut short.
Famous names have been tied to these overdoses, celebrities who seem to have it all, only to succumb to that tragic mix. It all underscores how serious these medications can be, and how vital it is to understand the bigger picture. Which, of course, brings us to that bigger issue, prescribing practices.
Right now, doctors often have extremely limited appointment times, maybe 15 minutes. That's not enough to do a thorough evaluation of someone's mental health, let alone explore therapy, lifestyle changes, or other interventions. So, out come the prescription pads. For many physicians, it's easier and quicker to hand a patient a pill than to go through the complexities of how they're sleeping, what their stressors are, or how they manage daily life.
And that's if you can even get in to see a psychiatrist or a therapist. The referral process can be slow, or there's a shortage in your area. Some people just want immediate relief. In fairness, if you're absolutely panicking or can't sleep for nights on end, I can see why you'd want the quick fix. But when that quick fix becomes a long-term staple in your life, you might start paying a high price.
A price that's not just physical, but psychological and even social. If your cognition and memory take a dive, it affects your relationships, your job, your day-to-day functioning. People feel trapped.
So let's talk about the best-case scenario for prescribing. You've got a type of anxiety that responds well to benzodiazepines. You take them short-term at low doses, carefully monitored. Meanwhile, you're working with a therapist or engaged in a supportive environment that addresses the root causes of your anxiety. As soon as you can, you taper off. That's the ideal scenario. The medication is a tool in the toolbox, not the entire toolbox.
Sadly, that's not what usually happens. It's more like an autopilot script. Take 2 of these and call me in a year. Meanwhile, your dose might go up if you develop tolerance and the cycle continues. Then you've got those pesky withdrawal issues if you try to stop abruptly.
If someone's been on these meds for a long time, the recommended approach is a slow, steady taper. Sometimes you switch from, say, Xanax to a longer-acting benzodiazepine first. Then you reduce your dose bit by bit. The success stories usually involve a doctor or medical professional who actually gets it, a person who knows how to walk you through the process. You also need a support system to keep you accountable, especially when you can't fully trust your own brain to recognize withdrawal symptoms as they creep in.
Yes, your own mind can trick you, making you think you're fine when you aren't. It's ironically called spellbinding. You might be worse off than you realize, or you might not notice subtle signs that you're going too fast with the taper.
Then there are fancy rehab centers that promise quick detox. Some might charge a fortune per day, but not all of them handle benzodiazepine withdrawal responsibly. Rapid detox can be dangerous. Rushing the process can be a recipe for relapse or more serious problems. Slow and steady is usually the name of the game, unless there's a crisis that demands another approach.
It's almost poetic how the medical establishment's pursuit of a miracle pill for anxiety led to so many new anxiety-related crises. The marketing convinced us that it was normal to immediately medicate any discomfort. Meanwhile, the deeper issues get overlooked, and that's how we end up with a population that's not only anxious but also dependent on a substance to function.
You can see the same blueprint in other psychiatric drugs, like SSRIs for depression. They too come with big marketing campaigns, widespread prescriptions, questionable benefits for a lot of people, and challenging withdrawal syndromes. This pattern of, here's a pill, now deal with the fine print later, has repeated itself.
Indeed, and we rely on the legal system, the regulators, and our medical professionals to keep us safe. But it's not always that simple. There's a ton of money in these drugs, and that money can speak louder than cautionary tales. So the cycle continues until it doesn't.
Maybe this is the moment the cycle starts breaking. People are starting to question these practices. They're sharing their stories online, discussing side effects openly, and demanding that doctors do better. It's a wave of collective awareness that could reshape how we handle mental health. We may finally treat these medications for what they are, potent tools that should be reserved for the appropriate time, place, and duration.
In a perfect world, we'd tackle the root causes of anxiety, like stress, lifestyle factors, or unresolved traumas, while still acknowledging that meds have their place in acute scenarios. We'd also have adequate support systems for anyone trying to wean off. It's not that we're demonizing benzodiazepines. We're calling for balance and mindful use.
And that requires all of us to ask more questions. If you or someone you know is on these meds long-term, the key is a safe approach to tapering. It might take months or years, but it's doable. Obviously, we're not giving personalized directives here. We're just highlighting an important conversation that's too often swept under the rug.
Right. We're shining a spotlight on it. Let's recap. Benzodiazepines, helpful in particular, short-term scenarios. Potentially life-derailing if misused or taken too long. Overprescribed thanks to a system that often jumps to quick fixes. Marketing contributed to an epidemic of dependence. Withdrawal can be brutal, but it's not impossible if handled carefully. We should look to treat the root causes of anxiety rather than just slapping a Band-Aid on the symptom.
Well said. It's a nuanced topic that deserves thoughtful discussion and responsible prescribing habits. We don't want to throw them out entirely, but we do want folks to realize that what might look like a friend can become a foe if you're not careful. And that's a wrap on our deep dive.
I'm grateful you all joined us for this exploration of benzodiazepines. Remember, our goal here at Dr. Mercola's Cellular Wisdom is to challenge the status quo in health, add a little wit to the conversation, and hopefully inspire everyone to dig deeper. Because when it comes to these tiny pills, the question isn't just whether they work, it's whether they're working for you in the right way.
Exactly. This topic is so complex, and there are countless personal stories that illustrate just how high the stakes can be. If you're currently living one of those stories, hang in there. There's a growing community of informed individuals and supportive resources out there to help you navigate.
And with that, we'll bring this chat to a close. Thanks for joining us today. We'll be back next time with another look at a health topic that deserves a closer inspection. Until then, stay curious, stay informed, and remember, sometimes the best medicine starts with awareness.
And a hearty dose of well-timed humor. Take care, everyone. We'll catch you on the next episode of Dr. Mercola's Cellular Wisdom.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.